Olmsted Medical Center has been really an integral part of this community since 1949. And I feel a big part of my job is for us to continue to be there for our community. I think we also try to impact our community in a thoughtful, systematic way.
That one of the areas that Olmsted Medical Center has done an exceptional job of providing and integrating the community since 1949 is realizing that we are in 11 communities outside of Rochester. And with that, every individual that's working in our clinics is ingrained in the community. Those are the areas that we commit dollars and time and energy to, because every single community is important to our organization. And we try to give it to close to 70 community organizations, throughout not only Rochester, but the surrounding areas that really align with our mission and our vision and our goals.
We're involved in many partnerships, and we don't have time to enumerate them all, but there are two that I'm especially proud of. One is our association with the Families First of Minnesota. We have partnered with Families First of Minnesota for two primary reasons. One is to help defray entry costs to get support training for new childcare providers. And secondly, we actively are funding Families First to continue with their great work with Crisis Nursery Center.
Families First of Minnesota is an umbrella organization that serves children and families in southeastern Minnesota and beyond. The needs during this COVID pandemic have only gone up geometrically, and so without additional funding, we'd have to turn people away, and that's not something that we want to do.
Childcare isn't a business you get into to become wealthy. So the cost that programs are having to pay for food and supplies and items for health and safety purposes and trainings and licensing fees, etc., all present a problem when you're not bringing in as much income. We're able to use these Olmsted Medical Center funds directly to create supports, grants, purchase items, things that would allow them to meet the opening license requirements. And so we used our Olmsted Medical funds at that time, the summer prior to our contract work, to make sure that we could continue doing what we've been doing for the 3+ years in the past.
The needs are great right now for these types of partnerships, and I would hope that corporations would understand that these are win-win opportunities, because if employees have the tools that they need to be successful, they're going to thrive at work and give you what you're paying for. If they're facing stressors in their private lives, their mind may drift during the day because they're struggling with things that they can't solve, and they're spending some of their work time trying to figure out solutions.
I view community as being not only our community at large, but I view our entire Olmsted Medical Center employees as a community that we're responsible to as executives. The responsibility that we have as executives in providing a very pleasant and rewarding experience for employees translates to great care for our community.
I think each organization, whether or not it's a healthcare organization or hopefully any employer that is willing to give back to the community, provides the resources and more importantly, the advocacy for each employee to give back in what an area that they feel is appropriate.
The commitment to how our employees fit into it is actually part of our mission, vision, and value statement, and we really try to live by this.
That's an obligation that we have to ensure that time is available for each person to actually do that work that they think is important.
We've been here providing high quality care for a real long time, and the community is actually counting on us to be there.
I think giving back to the community is intrinsic on why many of us chose the field that we're in. Any way that I can contribute to the betterment and advancement of the community, which allows us to advance as an organization, which allows our staff to be enriched by potentially having other opportunities, then, in the end, collectively, the entire community is in a better place.